are some of the most common symptoms of menopause?
You know what, Jess? So many people think it's hot flashes and night sweats, but I'm here to tell you weight gain, skin changes like a lot of wrinkles, and muscle and joint aches are some of the most common symptoms that women experience, besides insomnia and difficulty sleeping.
Interesting. And this can be in the perimenopause stage, right? Those are the same symptoms?
Exactly. I love that you know that, because perimenopause is that transition time before periods stop altogether. And perimenopause can last for 3 to 7 years, and often the symptoms are much, much more severe. But people are still having their periods, so they're not really sure what's going on. And sometimes it's even hard for healthcare providers to connect the dots that this is a hormonal change.
Yeah. And speaking of hormones and some relief from these symptoms, what is hormone replacement therapy?
So basically, estrogen declines during menopause, and virtually every cell in a woman's body has an estrogen receptor. So it affects how a woman sleeps. It affects her bone health, her gut biome, her nutrition, and her weight, not to mention her urinary tract and sexuality. So with hormone replacement, we are adding back some hormones for what women are naturally used to. So remember, these are natural hormones that our bodies are used to, we've had in our bodies since we were going through puberty. These are not the kind of hormones that bodybuilders use.
Okay, interesting. Now, does this pose a threat to cancer? Is cancer a risk when it comes to this therapy?
There's so much conflicting research and there's so much misinformation. And so what we say as healthcare providers is if, and it's a big if there's a risk of cancer from hormones, it's probably about the same risk as someone who doesn't exercise 3 hours a week, or someone who has 2 or more drinks of alcohol per day. So every hormone is different, but a lot of people are too worried about using hormones, and they're looking for hormone-free remedies.
Okay, aside from the relief of all of these symptoms, what are the disadvantages or maybe advantages of it?
So there's a lot of advantages to using hormones, and virtually, again, every cell in the body benefits. So women sleep better. There's less hot flashes and night sweats. Every aspect of quality of life is improved, including brain fog. But the disadvantages are some people have headaches or breast tenderness. Some people have irregular bleeding, and some people are really afraid of using hormones. And so one size never fits all, and that's why it's good to talk to your healthcare provider about what options are best for you.
All right, if somebody wants to take the route of not taking hormones, what are some hormone-free remedies?
Well, there's a new hormone-free remedy known as Veoza, and it works on the internal thermostat in the brain. And within 2 weeks, women see a 80% reduction in hot flashes and night sweats. But also, certain antidepressants also work to decrease menopausal symptoms. They don't have the other benefits of helping bones or the urinary tract or sexuality, but they help with some of those most bothersome hot flashes and night sweats.
Okay, and what about some other lifestyle changes that you can recommend just in general?
It's always a good idea to do weight-bearing exercise or resistance, to eat a more plant-based diet, and look for soy in your diet, because soy has plant-based or phytoestrogens that can help with a lot of symptoms. Mindfulness and meditation also helps during this phase of life.
Oh, interesting. Thank you so much, Nurse Barb.
It was great to see you, Jess. Take care.
You too.